Hi, welcome to week
It's
4.
3 o'clock.
We're going to talk about predictive analytics in healthcare during this week. Our learning objectives for this week are to describe the need for predictive analytics in healthcare operations, review different approaches to predictive analytics, differentiate between data-driven and subject matter judgment, develop validation controls for predictive analytics, and use predictive analytics for strategic decisions or in operational settings. Let's start with real-world applicability. So this is a real use case, and we're going to explore the potential of using predictive analytics and big data in emergency care. So in a health system or hospital emergency department or emergency room. Predictive analytics here can be used as simple heuristics or rules of thumb for risk stratification and diagnostic rule-out. Many of you know that patients getting care in the emergency department can be one of the most expensive places to get health care. So how can we use predictive analytics to benefit patients and health systems? We could estimate risk pools according to patients' entire clinical profiles. Their clinical profiles would be the data that already exists in their patient record in the electronic medical record, along with the additional information that is presented at patient registration and triage when a patient comes into the emergency department. Even non-clinical factors, such as the time of day, the day of week, or even the season in which the patient presents in the emergency department, can be included in this simple heuristic. So here's one example. Chest pain. So many times patients will present at the emergency department with chest pain. It could be something minor, or it could be a life-threatening event. The data for the model for predictive analytics could also include looking out at the date and the weather information and knowing that there was just a big snowstorm in the past few days. It could come back to the clinician with a question such as ask the patient if the patient has been shoveling heavy snow. There are various potential strategies for the use of predictive analytics in emergency care, as seen here in Table 2, which comes from a journal article for emergency medicine. So let's take a look at this typical emergency department visit. A patient arrives in the emergency department. A series of decisions must be made at that point. Each decision could have financial impacts, such as higher costs or higher out-of-pocket costs for the patient, risks of adverse events. So, for example, an elderly patient could come in, and while they're waiting in the hospital bed for somebody to come see them, they may have to use the restroom. They try to get up out of the bed, they fall, they break their hip, and now they have an additional injury. Incidental findings. So the patient may find out that they have some other type of condition that they were not prepared to know about or talk about. It could be something major, which would be a good thing to find out, or it could be something minor, such as a mass showing up on an image, which ends up being a benign mass. And also avoidable diagnostic testing and treatment, or over-treatment, as we like to call it. Stronger predictions use the data gathered from the emergency department, along with the existing clinical profile in the electronic medical record, to allow physicians to avoid additional tests, procedures, and admissions as an inpatient to the hospital. At the initial presentation, the prediction utility is often too low as there is insufficient data for accuracy at that point. On the other side of the continuum, after resource committing diagnostic tests and interventions are already completed, the prediction utility is basically useless since the resources have already been spent. So if you take a look at this graphic here, this helps us to look at what is the best time for predictive analytics in the emergency department. And if you look at this black funnel-like horizontal diagram, you can see that when a patient first arrives or presents to the triage group, there's a very wide degree of uncertainty. And as the patient goes through the emergency department workup, where questions are asked, and the patient responds, and then maybe there's some tests that are given, the degree of uncertainty closes, and by the time a patient ends up being admitted as an inpatient, there's a pretty good understanding of what that diagnosis is for that patient. So the optimal time to use predictive analytics is right at the end of the triage while the emergency department professionals are doing a workup, but before the patient is given too many expensive tests or treatments. How would we pay for predictive analytics? Because there's a high cost to working with big data and getting resources to create predictive analytics systems. Well, there are implementation agendas at the national, regional, institutional, provider, and patient level, and these could all be part of a model for funding. So what are the challenges, limitations, and potential disadvantages of predictive analytics in an emergency department setting? Well, we have data quality or bad data quality that could impact the accuracy of the model. There may also need to be some flexibility with the model. We can't always have a one-size-fits-all approach, so there may need to be different derivatives of that same model based off of age, gender, or other clinical factors for a patient. There can also be a challenge with the ease of use and acceptance from clinicians. Many clinicians have had bad experiences with technology and the electronic medical record. Many times clinicians have a lack of trust in those systems, and they want to be able to use their own professional judgment in making determinations on whether there needs to be tests ordered or treatment for the patient. And there's also a lack of inclusion of physician, patient, and caretaker perspectives in this type of model for predictive analytics that only looks at gathering information from the triage and the existing electronic medical record. But there's certainly benefits. Better predictions could make healthcare decision-making more cost-effective for both the patient and the health system, and at the same time, more responsive to patients' needs. So now let's look at what it means to say predictive analytics. Gartner, which is a consulting firm that specializes in various industries, including healthcare and data science, says that predictive analytics is a form of advanced analytics which examines data or content to answer the question, what is going to happen, or more precisely, what is likely to happen, and is characterized by techniques such as regression analysis, forecasting, multivariate statistics, pattern matching, predictive modeling, and forecasting. Let's cheat a little. So here is a one-page quick reference when starting to look at using predictive analytics in an organization. And you can utilize this link and go out to the dummies.com site and take a look at that cheat sheet. You may need to look at these slides outside of the video in order to click on the link. Data mining and business knowledge can help us get to predictive analytics. Many times predictive analytics uses a model, which is a mathematical representation of an object or a process used to simulate real-world phenomena as an investigative step to understand more clearly what is happening. The model's predictions drive more effective action. Algorithms can be used in predictive analytics. A well-designed and well-tuned model can forecast or predict with high accuracy the next outcome of a given event. Examples can include predicting the flu trends, the outcome of an election, or a snowstorm or hurricane. And what could possibly go wrong with predictions? A lot. And when it comes to healthcare, we can't have predictive analytics that risk patient safety. Let's take a look at the following key elements of predictive analytics. Emphasizing prediction rather than description, classification, or clustering, rapid analysis, emphasizing business relevance, ease of use, and a desire to turn raw data into informative insights. Gartner visualizes the various types of analytics as being on a spectrum, with descriptive analytics on the low end focuses primarily on information that has already occurred, then diagnostic analytics, providing insights, and then after that, predictive analytics, helping us to forecast, and then at the very top, prescriptive analytics, which gives us the foresight and knowledge required to create the desired outcomes. So wouldn't it be nice not only to know that we're having a blizzard coming, but how to stop it from snowing? Additional predictive analytic methods: analyzing data and manipulating variables, combining multiple predictors, and adding higher volumes of data. And in order to make this happen, an organization really needs to be at one of the higher levels of the Gartner Business Intelligence Maturity Model. For assignment 4, I'd like you to review at least 2 different techniques from your book, such as regression or other types of modeling techniques, and choose what works for you to answer a healthcare prediction problem. Choose a healthcare-related topic where you want to predict an outcome. I do not expect you to actually be able to predict the outcome. This is a practice. Some ideas include increasing or decreasing of patient visits, adverse events occurring, healthcare fraud, risk reduction, etc. Choose a method of your choice for predicting the outcome. This could be using a statistical model, an Excel formula, a visualization in Excel, R, Tableau, or other tools such as Microsoft Power BI. As an alternative, you could bypass using a software tool and write out an algorithm showing how data could be used to predict an outcome, and this could be in diagram format or narrative. If you run into any issues at all, please contact me during the week through Canvas.